Hello, my name is Daniel Ordeneaux, and I am an undergraduate student at Louisiana State University pursuing a bachelor's degree in nutritional food sciences pre-med. This research poster focuses on a randomized clinical trial performed in Madrid, Spain that examines if a Mediterranean diet with additional extra virgin olive oil and pistachios can reduce the incidence of gestational diabetes mellitus. Gestational diabetes mellitus is a disease in which pregnant women have high blood glucose values, which can negatively affect the mother and her child. This disease process is growing more prevalent and causing other health complications during and after pregnancy, such as type 2 diabetes mellitus for the mother later in life. In Figure 1-1 on the left-hand side of the poster, you can see the flow diagram of how the trial was conducted. All potential applicants were screened for eligibility and then allocated into either a control group or the intervention group. Then, follow-up appointments with these patients were made to gather data or exclude them from the rest of the trial due to disqualifying criteria. Some disqualifying criteria were patients suffering miscarriages, voluntary withdrawal from the trial, and switching hospitals. Finally, the data was analyzed for the 874 women who contributed to the trial until completion. To be eligible for this trial, the participants had to be at least 18 years old, single gestation, between gestational weeks 8 and 12, have a fasting blood glucose level of less than 92 milligrams per deciliter, and sign a letter of informed consent. Essentially, all individuals involved in this trial were knowledgeable of what patients were in the control group and the intervention group, except for the research assistant and the individuals performing statistical review. The control group received a basic Mediterranean diet every day, while the intervention group received the same diet with the addition of at least 40 milliliters of extra virgin olive oil and a handful of pistachios every day. Extra virgin olive oil is rich in monounsaturated fatty acids, which can aid in lowering glucose levels. Pistachios are rich in unsaturated fatty acids as well as fiber and magnesium. Both groups were also advised to avoid red meat, refined grains, processed baked goods, pre-sliced bread, soft drinks, fresh juices, fast foods, and pre-cooked meals. In the image in the center of the poster, we can see food options that fall into the basic Mediterranean diet, such as vegetables, fruit, legumes, and fish. The results revealed that there was a 6.3% less chance of developing gestational diabetes mellitus in the intervention group compared to the control group. The results also revealed that the individuals in the intervention group had lower fasting blood glucose levels, A1C levels, and gestational weight gain. Another note of significance is that the individuals in the intervention group that developed gestational diabetes mellitus required less insulin therapy compared to the control group. The newborn children of these women also saw clinical improvements such as lower incidences of hypoglycemia, respiratory distress, and admission to the neonatal intensive care units. This randomized clinical trial can be repeated for further verification and accuracy with a larger sample size to gather more data to support or deny this theory. The journal also mentions that a large portion of the participants were Caucasian and that expanding the trial to a more diverse ethnic group could be beneficial in obtaining better data. In Figure 1-2 on the right-hand side of the poster, we can see comparisons of maternal outcomes for the control group and the intervention group. The intervention group had lower incidences of health complications such as preeclampsia, albuminuria, urinary tract infection, pregnancy-induced hypertension, and perineal trauma during delivery. In conclusion, the data from this trial supports the theory that it is beneficial for pregnant women to consume a Mediterranean diet with at least 40 milliliters of extra virgin olive oil and a handful of pistachios every day to reduce the incidence of gestational diabetes mellitus. Thank you for taking the time to view my poster and listen to my presentation. If you have any questions, feel free to contact me through email at dorden3@lsu.edu.